So to start off, I already looked for a patient and gathered necessary information for us to input later. So now let's go and log in to OpenMRS. Then click the inpatient ward. And then now let's register our interviewee as our patient. And then we're going to fill in relevant information on the patient's dashboard, including her demographics, contact information, and relationships, and also others. After that, let's go and confirm. So now that we already registered our patient, let's now start the visit. So as we can see here, we have many options, but first let's go and admit our patient to inpatient ward first. Okay, so provide the admission date and then admitted by and also the inpatient ward, and then let's save. So after admitting our patient, now let's go and capture our patient's vital. So I already captured the patient vitals earlier, so now I'm just going to provide the data that I've gathered. So for the height, so as we can see, it automatically calculated when we input the height and the weight. Okay, and then after that, let's save it. So after capturing our patient's vital sign, let's now click the visit note. So I'm going to choose the provider and then check the location and also the date, and then add the diagnosis of our patient. So PCOS, confirm. And then on the clinical note, I already have the FDAR and I'm just going to paste it right here. I'm just going to add here my initials, and then I'm going to let you see the FDAR closely.
Here I am going to further explain my FDAR, and the focus will be disturbed sleep pattern related to back pain at night as evidenced by feeling weak. So we have all the necessary information of the patient, then we can see here the data including the objective and subjective as well as the vital signs of the patient, followed by the actions which serve as the intervention for our patient, and this includes assess the patient's sleeping habits, educating the patient about sleeping positions she can do, providing comfort measures, and also other that can make our patient feel better. And then the response would be after 2 hours of nursing intervention, the patient can now implement sleep promotion routines and also demonstrate sleeping position that can ease her back pain.
And then after that, we're going to save it. So after we're done admitting the patient to inpatient ward, capturing her vital sign, and adding clinical notes, we're now going to review all the details that we provided so that we can ensure that there's no wrong on our provided details. Okay. And then now let's go back to home. So we're going to find our patient. Here she is. Okay, so we can see here the updated information of our patient. And then now let's fill in this section, the allergy section. So unfortunately, my patient have a food allergy and it is moderate, and the reactions that she experiences when she has an allergy are headache, itching, rash, and then also fever. Okay, so after that, we're going to save this one, then return to home.
After returning home, here's the summary of the patient's information like the diagnosis, vital signs, latest observation, even the health trend summary. And lastly, we can now end our visit and log out. So now, here is the health education prior for the discharge of the patient. Among these, the most important thing to make the client understand is that lifestyle changes can also make wonders to her body, for it will save her from severe complications of PCOS. It includes teaching the patient proper diet and nutrition, such as encouraging the patient to eat a variety of healthy foods, including fruits, vegetables, whole grain, breads, and avoid limit intake of processed food as well as sweets. It's also important to remind her to stay active and contact her physician if her symptoms get worse. As for the health education rubrics, this is the guide that I use. And then now, these are my sources. I made sure that the content was appropriate to all the information I obtained on my patient's condition, its symptoms, and the appropriate treatments to aid in the patient's recovery, while taking note of the client's health information such as her basic information, vital signs, and allergies. So this is all important to check and identify occurrences of patient injury, assure quality improvement, and increase patient safety. Furthermore, accurate assessment of pertinent medical data is essential for medical claims.